Greetings again. It's good to see you. This is Unit 10, where we're going to discuss common swine diseases. As we transition to the final phase of the semester here, we'll be talking about different species and the common diseases that are associated with each. We'll kind of apply the knowledge that we've talked about all the way down to the cellular structure, kind of remembering some of those types of things as we move forward into diagnostics and treatment and surgical options, and a little bit on management sprinkled in here. So kind of recall some of the things that we've talked about earlier in the semester in the previous content areas, and work to apply those as we talk about this species-specific disease challenges. This segment is going to be broken up into a two-segment mini-lecture series, so let's get to our content here. Foot and mouth will be leading off our first mini-lecture part of swine diseases, and certainly one that you may never have heard of, and that's a very good thing. Foot and mouth disease is devastating, and one that I have never seen personally, and we have been very fortunate in the United States history only to have a very, very few outbreaks. This is one that has hit Europe on occasion, and is just, like I said, devastating. It's very, very highly contagious viral infection. And in the U.S., we have protocols in place that if you have even a suspected case, the United States Department of Agriculture is going to start some interventionary practices on your operation. Your local veterinarian would be required by law to report it to the state veterinarian, who would then in turn report it to the United States Department of Agriculture, and your farm would immediately be placed on quarantine. The primary reason for that is, as we move into transmission here, is this pathogen, this virus, can spread airborne for, I think it's known, up to about 5 miles. So if you're anywhere near any other operation, that operation also now becomes at risk. The virus is basically present in all forms in the body: saliva, blood, urine, milk, muscle, everywhere. It is circulating, so therefore it can be transmitted quite easily. To make the problem even more drastic is the virus remains alive in a dead carcass, in any animal byproduct. So if we send an animal to rendering, that would not clear the virus. It can contaminate feed, bedding, equipment, utensils, your pasture even. So, you would want to be very, very on top of it if you had any kind of suspected case. Like I said, I think it's been about a century since we've had the last suspected case of foot and mouth disease in the U.S. The clinical symptoms here, and you'll find kind of a repeating template to all of my slides as I get through each of these diseases. You'll see blisters develop in the mucous membrane. So think about huge, very sore blisters developing inside your mouth. That's what happens to pigs. And they'll have extremely high fevers within the first 14 hours. And I'm talking about up into that 106 or 107 degree temperature range, which of course now starts to affect brain function. There's no vaccine or treatment, so eradication of the infected animals is required. And so therefore, you would basically slaughter all animals right on your farm site and dispose of them right there. And I think much of it is burned and then buried. And then after a time of sanitation on your operation, should you survive all that, they would introduce a few test animals to your site to see if they contract the disease. And if they're healthy and nothing occurs, then you would be allowed to repopulate, if you would survive all that, repopulate your operation. So certainly one that we never, I don't think most of us have ever seen or experienced. And would be unlikely that we do, to be honest with you. But nonetheless is still out there as a risk factor that we would want to be available or aware of. Peritonitis is next, a little bit different type of problem here. Here we've got an inflammation or infection in the peritoneum, which is the cavity kind of outside of your stomach and small intestinal area. Generally associated, you'll see some tenderness or pain. Occasionally it's associated with an injury. Typical causes, of course, like I said, an injury could cause it, but most likely in pigs is some kind of perforation of the digestive or genital tract. These are more commonly fatal because you kind of have a slow leaking. For example, if you think about a small intestinal perforation or a small tear in the small intestine, that digestive material then would leak into the peritoneal cavity, which then causes or creates a great substrate for bacterial growth and infection to set in. And so it can be fatal pretty quickly. Clinical symptoms, you'll see a fairly high fever develop. Pigs will stand very rigidly because it's quite painful in their stomach region. Probably they will not move, so they'll be dehydrated, they won't go drink. And this one is associated with a high heart rate. This is a little bit unique to this particular disease. Treatment for peritonitis can involve surgery for the right animal, the right candidate. You can go in there and open them up and suture that perforation back closed, and or antibiotics. Sometimes if it's a mild case, antibiotic and just a little bit of supportive therapy will help get them through, and that small perforation will heal on its own. Next is what we call swine edema disease. This occurs typically in pigs between the ages of about 4 to 14 weeks, so somewhat young pigs, and this is an E. coli infection. Pay attention to E. coli, folks. We will see this particular bacterial pathogen recur in a number of places through this section and many others, but it colonizes the small intestine and starts to produce a toxin, usually associated with some kind of stressor, whether it's moving or a respiratory infection or something like that. Clinical symptoms, on occasion we can have just sudden death of otherwise healthy pigs, within the first 6 to 24 hours on occasion. Higher death loss occurs most of the time we're talking about after weaning or vaccination, basically any stressor that you can think of. They'll have a number of different symptoms that you would have to sort through to identify which disease you're actually dealing with, because again, some of these are going to be associated with multiple diseases. So there's a lengthy list there, but the giveaway to this one is edema around the eyes and the jowl, which is the jaw, face or ears, and then some lesions on the belly. That would be unique to swine edema. Prevention and treatment strategies here, number one, primarily reduce stress. Try not to multiply different management operations that you would be doing to your pigs. And then, of course, antibiotic therapy. Next, let's talk scours in pigs. And of course, this is one that's extremely common and one of the leading causes of death in baby pigs. So it's very, very highly fatal. And clinical symptoms here are extreme diarrhea, quick weight loss, listlessness, maybe associated with something respiratory going on. And there's our friend E. coli again causing this particular problem. And it's oftentimes associated with poor ventilation, an unsanitary environment or something like that. Prevention here, again, clean environment, sanitation, antibiotic therapy, and then you can also vaccinate your sows against it. Sows in the first time the farrowing gilts. That'll help build up some antibiotic response that they can then pass on to those baby pigs. Next is cystic ovarian disease, very high cause of infertility in sows. And there are typically two types of cysts. You can either have a follicular cyst where a group of follicles, so ovulatory follicles that would be carrying an egg, just don't ovulate off of the ovary for some particular reason. Might be hormone imbalance, might be nutritional imbalance, might be stress related. That pig probably will come into heat every couple days and but still not be able to get bred because they do not ovulate. Or a luteal cyst, where a corpus luteum, which is a kind of a structure that replaces an ovulated follicle, fails to regress and so continues to produce progesterone off of that CL. And so the pig never even comes into estrus, a condition we call anestrus, and therefore doesn't breed, of course, because she never comes into heat. That's cystic ovarian disease. Next is retained fetal membranes here. This is a condition where the sow fails to expel the placenta after farrowing. Sometimes very unknown reasons for that. It's oftentimes associated with a few things that are listed here. Number one, dystocia. If she had a difficulty birthing that litter of baby pigs. That may cause her to retain her membranes. Oftentimes abortion. If a pig farrows way too early, aborts that litter of piglets, she'll probably also retain her fetal membranes because there was something else associated going on there. Nutritional status also highly affects retained fetal membranes. The effects of this is going to be lower milk production, and so protecting that litter of baby pigs is really critical here. Reduced appetite, fever, lower conception rates to follow the next breeding time. So treat these things, of course, again with antibiotics. Support that litter of baby pigs. They may need cross-fostering or something of that nature, or some milk replacer in order to help get them through. Otherwise, you're going to put that litter of piglets at risk as well. And oxytocin therapy can also aid in getting you through this particular disease. That helps relax and provide a little contraction to the uterine body and help expel those membranes, hopefully. Next is porcine leptospirosis, sometimes in pigs known as repeat breeder syndrome. And this one is associated with abortion on occasion, especially in pigs that are greater than 60 days in gestation. These pigs will probably have a fever, and this one you can track oftentimes because it's got an incubation time of about 7 days, so a little bit longer than some of the other ones that we've talked about. So you can sometimes trace where they got exposed to lepto. Treatments again here, antibiotics, culling. You could simply just remove them from the herd if you suspect lepto, or in a extreme case, blood transfusion. So I'm going to allow you to pause, take a moment, gather your notes up. We'll resume in a little bit with segment 2.